Hi everyone, Dr Alex Perry here, Chinese medicine doctor, founder and director of the Blue Sky Chinese Medicine Clinic. I was speaking to a patient this morning and they asked me about pulse diagnosis, and this is an important part of the set of diagnostic tools within Chinese medicine, a very important part. And it's not something that's perhaps very well understood or very well explained to patients undergoing Chinese medicine treatment or thinking about Chinese medicine treatment. So I thought I'd talk to you just briefly about what pulse diagnosis is in a nutshell. And within the framework of Chinese medicine, there are a number of different methods that we use to collect enough information to then form a diagnosis. Obviously asking questions, observation, including looking at your tongue and listen, what I would describe as listening to your pulse or feeling for the pulse on the radial artery of both sides of the body, so the left and right hand. Now, Chinese medicine is an observational medicine. It grew out of thousands of years of clinical observation by Chinese medicine pioneers who took a very close look at the subtle changes that were observable in the body, either by looking or hearing or smelling or touching, in other words, palpating or feeling what's happening in the body. And being able to look very carefully and to be able to understand or to see the subtle changes in the body in relation to what's actually happening on a physiological level. So things change in the body when we're well and when we're unwell. And those are the small, subtle signs that we're trying to pick up. And the pulse is a very good tool for doing that. So when people ask about pulse diagnosis, really I would talk about a few things. There are some standard things that we would feel in a pulse. We would feel for rate, rhythm and force, and that's pretty common across any medical modality, feeling pulse. But there are a few other things that we listen for in pulse diagnosis within the Chinese medicine framework. And one of the qualities, or one of the things that I sort of think about in terms of describing, is that your pulse takes on, it's almost like it takes on a personality or a characteristic depending on what's happening in your body. So there are things you can tell with some degree of accuracy from reading the pulse. And a good example of that is the pulse will change if there is stress or tension in the body. It can be emotional, it can be physical stress. Sometimes it can be underlying stress that the patient isn't even really aware of, but it's having a physical or physiological effect on the body. And the way that the pulse changes in that example is the pulse becomes what we would describe as string taut. It's a bit like, imagine a guitar string or a string that's tuned very tight, so it doesn't take too much twanging to get quite a strong resonance or effect from that. And the pulse is a little bit like that. So what you're feeling for is a fine string-like pulse which really hits the fingers very hard, and that is a string taut pulse, and that's pretty typical in stress, for example. So the pulse does change, takes on different characteristics depending on what's happening. Now, interestingly enough, the pulse diagnosis is a way of, as I said, reading some of the subtle signs and changes within the body. It's not, and I was trying to think of an example to my patient this morning, and I was thinking about a cardiologist who listens to the heart. Now, there are all sorts of modern medical tools and tests and machines for measuring all parts of physiology in the body. But a good cardiologist, even a good GP, someone who's trained to listen carefully with a stethoscope, can pick up a lot of information, very clear, specific information about what's happening in all the different valves and the chambers of the heart just by listening. And I suppose pulse diagnosis is similar in the sense that we're reading the body, and there's a lot you can get from the pulse. You've just got to know what to listen for and how to listen for it, and then how to make use of that information. So I think pulse diagnosis is a really interesting aspect of Chinese medicine, of the Chinese medicine framework. And it's worth having a little bit of an understanding of why your Chinese medicine practitioner is feeling your pulse. There are other aspects that we could talk about. Why does your Chinese medicine doctor always use 3 fingers on both sides of the body? But we can talk about that another time. Suffice it to say at the moment that pulse diagnosis is a really important part of your Chinese medicine practitioner's toolkit in determining a diagnosis, or indeed seeing how your progress is going from treatment to treatment. That's a really important aspect. So good luck with your health, and if you've got any queries or questions, please email me at reception@blueskyclinic.com. chinese.com.au, or you can call us, or you can get us on Facebook or Twitter, any of those things. If you like the video, tweet it out there, and I look forward to hopefully meeting you soon.